So today I want to talk about the topic, why do the outside of my knees hurt when running? My name is Dr. Chad Kuntz. I'm a clinical sports and performance doctor, and I constantly work with runners, and a lot of times it is the outside part of their knee that bothers them. It's certainly not the only part that can bother you when you're running. Lower extremity in general is obviously the most common areas that we can find pain with runners. It's quite common. Last study I had seen that up to 78% of runners can have lower extremity pain. That means from the hip down. That's a lot of people. So regarding the outside of the knee, there are really three top diagnoses that I would want to be curious about. I'd want to look at your iliotibial band or the IT band. We'll talk about that in a second. I'd want to know what your patella is doing. A lot of times you can develop what's called patellar instability, which just means that your patella kind of shoots too far laterally, okay? And then the third one would be a meniscus irritation, where you're starting to develop some irritation and some inflammation within the joint. So guys, quite honestly, with all three of these cases, I see this tendency a lot, that when people are running, their knee shoots inwards. When their knee shoots inwards, what you get is an opening, a tensile force here, okay, which means this is kind of elongating, and this is getting compressed. Again, so you have a tensile force going up and down this way, and then you've got a compression force on the outside of your knee. Now, the justification for the IT band causing you pain, so if we kind of take a look laterally. So remember guys, the IT band does a couple of different movements, all right? What it really does is help bring the leg out into abduction, and it also does internal rotation. All right, so it also will kind of move your femur internally. And then the last motion that it does do some hip flexion. And so again, just what that means to the side for me is that it'll move your knee up, up into this kind of region here. So it does three different motions: flexion, abduction, and internal rotation. Now a lot of times when people are running, their knee will go in. That puts it puts an eccentric force on the IT band, and it causes it to get really tight. So that means you can foam roll this thing to the day you die, but because of the way you're running, you're putting a tensile force on the IT band, and that can cause some pain. Along with that, similarly to that, your patella can move laterally, and all of a sudden it doesn't necessarily sit in the right spot. So I want to just zoom in on that a little bit more for you to have a better idea. So we'll take away some connective tissue. So you can see how the patella should be sitting there. Now imagine though, if you have a strong force pulling you like that, all of a sudden the patella is sitting there. Let's just say it's sitting there. Now if we take a look from the side, you can see how we're kind of designed to have that perfect groove align well, but if you have that patella moved too far to the outside, it's not going to be sitting where it needs to. And then since we're here already, we'll talk about the meniscus. Remember, I think this is simple in the sense that we talked about when you're running, and if your knee comes in, this will be where the tensile force will be. This will be compressed. You may not have enough shock attenuation through the quads because they're not in the right position to strengthen. You're not using your glutes, and so therefore the lateral or the outside part of your knee can be causing your discomfort and pain because, well, it's taking a lot of ground reaction forces. When you're running, it's quite significant. The last I had seen, it's up to 3 to 9 times your body weight can occur when you're running. That's a lot of weight that your body would have to handle. So in that case, it'd be really the outside part of your knee. So those are really 3 reasons that could cause your lateral knee pain with running, and it's all based upon one idea, that your knee is going in when you're running. Now it's a simple idea, but it can be difficult to treat just because you really have to reteach your body how to learn. I hope that makes sense. Thank you guys so much for tuning in today, and we'll talk to you soon.